actually been out in the country for the last 3 years, I think everybody will have some perceptions about what Morecambe Bay is and what Morecambe Bay healthcare system is. Better Care Together started off in about the autumn of 2013, whereby basically initially it was a couple of the commissioners with obviously the Morecambe Bay provider got together to try and thinking about and address some of the major issues that they had in our health economy, and they were major issues. One, about the quality and outcome of services. Two, the sustainability of services. Three, the large resource gap around Morecambe Bay. And fourthly, and not very least, trying to improve patient experience, because the general public had obviously lost a lot of trust in the whole health system around that area. So Better Care Together now is a very much different type of programme than it was back in those early days. We now have 8 healthcare partners who are actively involved. We've also got 2 GP confederations, and also we have a number of third sector organisations. But the aims have not changed in terms of what we're trying to do. And just to put Morecambe Bay in perspective, I mean, we all know all large-scale change programmes needs a case for change. As you can well imagine, it's probably easier to get the case for change as compared to what really is going to be the vision for the future when you involve so many different types of organisations. But just to put the thing in perspective and the type of advice and support we're looking for the ClinicalSenate from, is that Morecambe Bay, obviously, if you look around the country, I think there is about 1.4 hospitals for every 360,000 population in the UK at the moment. We have 3 hospitals. We have the largest geographical area in England trying to cover. I think it's about 5 times the average. And obviously, we have some major issues about trying to obviously staff 4 hospitals, as well as obviously the whole workforce agenda in the patch. So I think the issues have obviously been well documented. The first phase of Better Care Together was very much about an option appraisal and exercise around what type of reconfiguration of hospitals could you have for that scale and that diversity of population. It didn't get anywhere because fundamentally it hadn't looked at the whole system. So in July 2013 we reversed the question and said, if for the population of 265,000, what type of healthcare system that we need across both our primary and community systems that will support a future hospital configuration. And like a lot of healthcare economies and communities, we have been through a 12-month process of looking at numerous options. I think we've looked at 150 possible options, which we got down to an eventual shortlist of around 4 to 5. And predominantly most of the options, and from what our engagement with the public as well as the clinicians, and it has to be said at the moment, there is about 300 clinicians now involved in Better Care Together across the various organisations. Looking at the delegate list today, I think there's probably 1 clinician from Morecambe Bay. There might be some others that might have come in from the various commissioners, but it is very much now a process that has been clinically led from day one, but it's now also about clinically led through design and implementation. And in a nutshell, we've been through a strategy phase, and looking from the vision through to now what we believe is a more design and implementation process. Our strategy is probably no different to an awful lot of other health communities around the country, but I think the scale of changes that have got to happen, and at the time scales, given where we're starting from, probably is going to be very much at the fast end. And obviously we are pleased to have been recognised as a potential national pilot site for the Vanguard site. That will bring its own challenges as well, but I think from the local clinicians' perspective, actually having some good news coming out of Morecambe Bay after some of what's gone on previously is only good. Because like most health systems, and social care systems, there's an awful lot of good work going on besides some of the issues they have to address. So in terms of a strategy, we have actually moved to developing potentially what they call locally an integrated care service provision network. I think the vision amongst the 8 organisations is that we will move towards an accountable care type service provision system. What that means in practice, we're obviously hoping to develop further in the next 12 months with the Vanguard project. But I think there is there's been a growing consensus amongst all the organisations that we obviously need to actually redesign our clinical models, but we need to have both a system and an organisational framework that makes sense for the future. And certainly a lot of the things in place at the moment do not make sense for the area of Morecambe Bay. So one of the key tenets of our strategy is to develop potentially 14 integrated care teams, and they're going to be very much health and social care, and also involve acute clinicians in various different teams. It's early days yet, but we have developed at least 7 teams this year already, and we are trying to develop quite a number of them into more of a larger teams in conjunction with our local hospitals. So just to give you a snapshot of what the strategy is about, as I said before, it's about a system change, not just about hospitals. It will take at least 5, and I think that's an optimistic assumption. This is a 10-year program. If you look at the whole system change programs internationally, or if you look at the examples in Sweden or Spain or anywhere else, they all talk about a journey of 10 years. And so we've been going about 2.5, so we've only really just started on this journey. But we actually are after some what is known as quick wins, and we certainly have been engaging often with our local residents. And I think importantly, in coming on to what the ClinicalSenate, our strategy is about actually trying to maintain and sustain some core services in our locality. Because as you will all have read in the press, we do have some issues around our maternity services, which are improving, and we do have issues like a lot of small district general hospitals or rural communities around sustaining A&E or urgent care services in their current format. And we do want to sustain and maintain local services, whether it's for the Barrow population, whether it's for the South Lakes, or in terms of Lancashire and Morecambe, but we recognise we need some different models, but we also need to actually maintain and be very clear about what are the clinical standards we are trying to meet. And the biggest area of our work around we want to develop on clinical standards around is obviously the out of hospital and the interface with our future, obviously, acute hospitals and pathways. And that's not just about physical health, it's also about obviously the wider health in terms of involving our mental health colleagues and the type of services for the future. And as you say, we also have proposals on the table around the modernisation of maternity and children's, which were prior to Kirkup, but obviously now are going to have to be very much geared towards some of the recommendations in the Kirkup report. And a final bit of our strategy, which is a bit about some reconfiguration of services, is about what type of elective surgery and what type of surgery system and elective services that we need for the future. We are currently trying to redesign a lot of our planned care pathways across a lot of the specialties. But in terms of what we can actually provide as a good quality service in terms of elective surgery centres and the whole pathway, and then the surgery bit of the pathway, we obviously have been looking at some different proposals around different types of site models. And as I say, this whole programme has got massive enablers to it. We are very much looking to try and explore new solutions around the workforce, even recruitment, retention of staff, and we're also trying to build on some of the good work in the health community around getting some of our information systems to work together and join up. Cumbria side is blessed and some Lancashire side is blessed with some decent systems, but at the moment actually getting to talk to each other and actually getting all the clinical groups to actually use them as part of the ongoing provision of being part of integrated care teams is one of the biggest challenges we've got. And last but not least is the cultural change. We are currently, I've been fortunate to become one of the pilot sites in the health education northwest around integrated workforce redesign, and we're trying to use some of the investment we've got from that and also hopefully from the investment we're going to get from Vanguard to start to really try and help some of our groups and staff groups and clinical groups work differently, because everybody in Morecambe Bay is going to have to work differently to make this happen over the next couple of years. So as you say, that I won't go into mass detail. If you want to get into more detail about Morecambe Bay, it's all on our website. We have obviously a Better Care Together website, which gives some examples of some of the things we're doing in the respective communities, and also some of our major documents, whether it's our strategy or whether it's our 2-year delivery plan, which the ClinicalSenate have had the pleasure of reviewing as part of their role as part of NHS England. But I'll come on to now what we really would like the ClinicalSenate to help us to do alongside obviously that assurance role. And this comes back to providing some assistance around some of our 3 strands around our outcome work, and also some of how we actually get our people to work differently. Before I move on to that, just to put into context, as you say, we're now in the business of trying to move things forward in terms of design and implementation, and as I've mentioned, we have become a vanguard site, so we are hoping that we can be able to fast track things quite quickly over the next 12 months. And in that context, we certainly, from the discussions we've had with the ClinicalSenate, we are looking for help in the terms of a clinical friend role about what type of clinical standards do we need for the future that supports our integrated care network system within an accountable care type of service provision, and also any changes we're trying to make to elective surgery and the service configuration. Again, what are some of the clinical standards we either must maintain or ensure that we are improving as we go along that journey. And finally, not least, and probably the more difficult and contentious area, is what are the clinical standards we can achieve in our patch around A&E and maternity. And as some of you will know, there's a national maternity review project going on that, and we obviously, I think, will be very much part of that process as well. And the ongoing work of reviewing our care models, because we've got a programme of work that is for the next 3 years of developing and changing things around our care models, and we need checkpoints in that process about making sure that we are doing the right sort of things. There is an evidence base attached to it, even a growing one, and also we're learning from others as well as we go along. And finally, not least, and it was said to us by a number of people, Chris Ham came to see us a few months ago, and he's coming back, that I suppose when we turn up as a system on our programme board or our delivery group, we need a new set of potentially metrics around what is a whole system outcomes and sort of performance framework that we need for the future. We have bits of it already in the respective silos, but really what are the things we really want to measure and actually be held accountable as we move forward? Back to that sort of triangle I showed you around, we really are trying to improve outcomes, we're trying to improve the sustainability of our services, and finally not least, we're trying to obviously improve it for our public, and they can actually turn around and say, yeah, we are actually getting a better deal from our health services than we are at the present time.